Good morning, everyone. Welcome to the first What About Wheat webinar. We are recording this session so that we can share it with you after in either English or Spanish. We're thrilled today to be joined by registered dietitians, health professionals, and people curious about wheat nutrition from across Canada and Mexico. My name is Elaine Sapunik, and I'm the Vice President of Technical Services at Cereals Canada, where I oversee the technical activities related to the assessment of wheat, flour, and semolina quality, and the quality of end products made from these ingredients. I'm also a member of the working group of the Canadian Wheat Nutrition Initiative, and I'll describe that to you in a few moments. Today's webinar is brought to you by What About Wheat, and it's presented in partnership with Il Cereales, the Latin American Cereals Institute. What About Wheat is a Canadian communications campaign to bring up-to-date science and evidence-based nutrition information to nutrition professionals as well as consumers. The campaign is funded by the Canadian Wheat Nutrition Initiative, a group that knows wheat from farm to fork. Our members include grower associations and millers from across Canada. The Canadian Wheat Nutrition Initiative is advised by a scientific advisory council made up of food and nutrition experts, and two of them are with us today. Before I introduce our speakers, I'd like to go over a few housekeeping notes. Today's presentation will be presented in English with simultaneous Spanish interpretation provided by Monica Ruiz and Carlos Villard. To hear the interpretation, please click on the icon that looks like a globe and select either English or Spanish. We will be asking for your participation in today's discussion. We will be using the chat function to gather your feedback throughout the webinar. Please feel free to add your comments in the chat in either English or Spanish. If you have a question for our panelists, please use the Q&A function. Our panelists will be taking your questions at the end of today's presentation. During the presentation, there will be a few pop-up polls for specific feedback. And again, at the end of the webinar, we would like your support and assistance by completing a short survey. We hope that this will be the first of many webinars to come, and your answers will help determine the right content for those webinars. I'm delighted to introduce our experts for today's webinar. Dr. Alison Duncan is Professor and Associate Director of Research of Human Nutritional Research Unit in the Department of Human Health and Nutritional Sciences at the University of Guelph. Dr. Duncan is also a registered dietitian and a fellow of the Dietitians of Canada. Her teaching and research relate to the biological effects of functional foods on chronic disease-related endpoints evaluated in human intervention studies, with a particular focus on the agri-food health continuum. Dr. Duncan is joined by Dr. Megan Racey. She is a nutrition and human health research consultant. Dr. Racey is passionate about nutrition and sharing research to bridge the gap between academia and the public. Megan's past research has included a range of topics, including nutrition communication to children, as well as nutrition and care of the elderly. Also joining us is Daniel Guerrero from Cereals Partners Worldwide. Mr. Guerrero studied nutrition and food sciences at the Ibero-American University in Mexico City. He also obtained a master's degree in marketing. He has 15 years of experience in the food industry and is currently managing nutrition and regulatory affairs for Latin America at Cereals Partners Worldwide. We are thrilled that the three of them can be here today to share their time and expertise with us. And now I'm going to pass over the presentation to Dr. Alison Duncan.
Thank you so much, Elaine. Thanks for that introduction and all of those notes. I'm going to share my screen and pick up where Elaine left off. And I will put it into presenting. So first, I just want to say how happy I am to be here with everyone on this webinar. I really enjoyed putting this presentation together along with Meg and kind of just thinking about this material and sorting through it. And Elaine mentioned that Meg and I are experts, and I really kind of think that everyone that's here today is an expert as well. And so I'm looking forward to learning together, and that's why we kind of made it interactive, and we have questions for you, and we're going to work through this together. And so to start though, I do want to disclose that both Meg and I are serving as members of the Scientific Advisory Council for the Canadian Wheat Nutrition Initiative. So as an outline of our presentation today, we are going to cover 5 overall topics related to wheat. We're going to talk about the basics, wheat basics and nutrition, get some terms and some ideas settled. Then we're going to move on to more specifically examining refined wheat and nutrient fortification. Then we're going to talk about wheat in different health areas like heart health, diabetes, and gut health. And for each of these topics, we are going to examine a question together. That's going to be participation. We're going to summarize some background information, and then we're going to showcase into a spotlight research study to look at some evidence. Now, some little notes about all of this is that we do have Monica and Carlos translating this information as I speak for our Latin American colleagues. So I am going to try and go slowly, which will feel kind of unnatural at times, but I'm going to try hard to do that, and people may remind me if I'm not. Another little note is that we want your questions, so throw them into the Q&A box at any point during the presentation, and Meg and I are going to go through them at the end of the presentation. And rest assured that we want to make sure your questions are answered. We know that you're attending this webinar to get your questions answered. So if we don't get to all of them, we're going to figure out a way to get those questions answered for you. Okay, so we're going to start then with just with some opening notes. First of all, to recognize that wheat is grown across Canada. It's grown on thousands of family-owned farms. And if we think about wheat, we realize that it's a member of the cereal grains family. Cereal grains. So this also includes barley, rye, and oats. And in Canada, we're referring to wheat as a grain. However, in Latin America, wheat is referred to as a cereal. So a grain, a cereal. This map of Canada is just kind of illustrating the distribution of wheat production across Canada. Indeed, Canada is the 5th largest wheat producer in the world. There's 50,000 of those family-owned farms that are growing wheat. And there's a lot of wheat that's produced per year in Canada, 30 million tons grown per year. And some other kind of notes about wheat. We remind ourselves that wheat is actually a plant. So it includes roots and leaves and flowers and seeds. It's a plant that's grown, and we see it all over when we're driving around Canada. And when we look more closely at when we are actually processing that wheat plant, it's wheat seeds or kernels, the wheat kernels. That's the part of the plant that's being milled to produce all the different flours and then the food products. And so when we look at that wheat kernel, we see that there are kind of 3 major parts, and these are familiar to us. So there's the outside layer, the bran, and that's that outside layer that has the dietary fiber, the B vitamins, the antioxidants. And then we see the largest part, that inner endosperm. This has a lot of nutrients. This has the protein, the carbohydrates, and some micronutrients. And finally, we're familiar with the germ, which is that inner part that is really the embryo of the plant. That is what enables the plant to reproduce. And that contains vitamin E, B vitamins, and some minerals and healthy fats. And so this is right away, we're going to get you working. So we want to put a question to you. What is the difference between whole wheat bread and whole grain wheat bread here in Canada? And we're going to ask that you just put some of your thoughts in the chat function. And I'm going to kind of be looking at the chat function and saying some things. And this also gives us a point to pause for a minute or so to allow our translators to catch up. And I'll be kind of reading things out in the chat. So just throw some things in. I'm not going to say anyone's name or anything. I'm just going to look at the chat and start saying things out about this question. And speak slowly. I will speak slowly. Yeah, so some notes here. Whole wheat is not necessarily whole grain. So whole grain wheat is 100% close to it, maybe. It's a really good question. What about other grains? Whole grain could be other grains, not just wheat. So other grains like oats or barley. It's such a subtle distinction. Whole grain includes the germ and whole wheat doesn't. So whole wheat versus whole grain wheat. And both can be delicious, of course. Is it a mixture? Yeah, and so these are just kind of different thoughts that when we think about this question. All right, very good. Okay, so I'm going to go on to the next slide. And this slide is where we're going to talk a little bit about this. So wheat nutrition, wheat flours defined. So here in Canada, we have whole grain wheat flour and we have whole wheat flour. And before I go over this, these notes here, just verbally say that when I think about it, I think about the fact that whole grain, the concept of that is that the entire grain in the proportions that it naturally exists in the plant are still present. So that flour is produced such that that is still the same. Whereas in Canada, whole wheat, it may still include those three components, but not in the same proportion. So it's a subtle distinction and it is a little confusing. So whole grain wheat flour includes all of the wheat kernel in the same proportion. So we've got our endosperm, our bran, and our germ. And what we're looking for on the ingredients list or in the flour itself is the whole grain wheat flour. Whereas in Canada, we also have whole wheat flour. So that's including all the endosperm, but only some of the bran and very little of the germ. So here we're seeing whole wheat flour. And then in Canada, we also have refined wheat flour. So this is, again, including all the endosperm, but none of the bran or germ. So both of these are removed in the milling process. This is enabling a prolonged shelf life, reducing rancidity. And because of the nutrients that are removed here, in Canada, we have mandatory enrichment back with the thiamine, the niacin, the riboflavin, and the iron. And as well in Canada, we have mandatory folic acid fortification of white flour. So that is all in there. What we're looking for here is enriched or all-purpose wheat or white flour. So that's a little chaotic, but these are the terms that we're looking for in our basic wheat nutrition with wheat flours defined. And as a reminder, just throw your questions into the Q&A box and we will get to them. Now, we can't talk about wheat without talking about gluten. So just some reminders on gluten. It is a plant protein found in wheat. So it's a protein. It's located in the endosperm, that inner large part. And when we think about gluten, we really think about its functional contribution. So I think we're pretty familiar with the fact that gluten contributes that elasticity, the extensibility to the dough, and it essentially holds foods together. Now, the idea of wheat is thinking about that agri-food health continuum. I like to think about that a lot with the different agri-foods we have. And wheat-based foods, definitely they are in that continuum. Wheat-based foods are staples of our diet. We're eating them a lot, and they do go right from the farm right through to our plate, and they can affect our health. And so we indeed see that governmental organizations across the world are recommending grains, especially whole grains, and that includes wheat. So we know Canada's food guide with the plate, 1/4 is whole grains, whole grain foods. We know with US, My Plate, the dietary guidelines, 1/4 with grains. And as well in Mexico, their food-based dietary guidelines, eat whole grain options of foods and legumes daily. So that brings us to our first research spotlight to get us interacting with the literature. So I thought this was an interesting study because it really showcases the consumer confusion. And I think literacy around these topics, consumer literacy, is really important for interacting with our clients and patients about wheat. And so this particular study, it was a survey of about 1,000 adults in the US, and they focused in on whole grain content of products and looked at consumer perception. They looked at various products, breads, wheat-based products, breads, cereals, and crackers. And they examined whether or not these participants could accurately identify how much whole grains were in these foods. And the results showed that up to half of the participants overestimated the amount of whole grains in the foods. And this was largely due to different labels on the package that were a bit misleading, like multigrain or honey wheat. So kind of non-regulated indicators on the product package that are more descriptors and not necessarily true to the whole grain content. So this is interesting. And this is me slowing down a bit to note that, these are sources of confusion, and us understanding what whole grains are in wheat-based foods can help us to consumers to navigate these ideas. So this brings us to another question that is thinking about shifting to this concept of refined wheat products. There's a poll. What would your client think about refined wheat products? Could they fit into a healthy diet? Would your clients think, can refined wheat products fit into a healthy diet? Yes or no? And you can just throw a yes or no in the poll there. This is your clients. And so the poll was up there. Okay, and then in terms of getting, oh, there we go. I was going to say, in terms of getting the results of the poll, we see it here. I'm thinking you might be able to see it too. And we see that it's, these are the clients. So it's like 70-30, yes, no. Very good. Yeah, and that's not too surprising because there will be mixed views on this. So this is a topic we definitely wanted to explore. This idea of refined wheat and where we're at in Canada with the nutrients in refined wheat-based products. So we know when we talked about the flours defined that refined wheat is milled, all wheat is milled, but the refined wheat has the bran and germ removed. So the endosperm is still there. And this is a lot to produce appealing texture and longer shelf life. But because of the nutrients that are removed with the bran and germ, in Canada, the refined wheat is enriched. It's enriched with thiamine, riboflavin, niacin, and iron. So those nutrients are put back in order to account for the losses in the milling. And it's fortified with folic acid. And that more relates to our public health since 1998 decision to fortify white flour and pasta and cornmeal with folic acid to address neural tube defects. Now, there's also the option voluntary to enrich with vitamin B6, pantothenic acid, magnesium, and calcium. And so this is all to say that these refined wheat products, although there are removal of nutrients, there are nutrients added back in through mandatory enrichment and fortification. So this is relevant for us to keep in mind. And this particular research spotlight, I think, is a really good fit into this story here, because it specifically examined refined grains in order to see whether consumption of those refined grains made a difference in the nutrient intake of US adults. And so this study used a really large data set, the NHANES data set, that's the National Health and Nutrition Examination Study. It's an ongoing database in the US that includes dietary intake data. And so they looked at more than 20,000 adults, and they did a sophisticated mathematical and statistical modeling exercise to examine the nutrient intake of these 20,000 adults after they removed their consumption of various refined grains. That is breads, ready-to-eat cereals, RTEC, and all refined grains. And the results of this analysis show that when those refined grains were removed, when certain specific ones were removed, it resulted in a higher percent of these people not meeting recommendations for nutrients like fiber, folate, iron, magnesium. And so this specific study, published in a high quality journal, is establishing that refined grains do contribute to nutrient adequacy in the diet of US adults. So this is a really good research study to demonstrate this and provide this evidence. Okay, so we are going to shift now to start to talk about wheat-based foods in different areas of health. We're going to examine heart health, diabetes, and gut health. And so here with heart health, we're going to open it up just with thinking about what nutritional components of wheat-based foods could be good for the health. And so I'm going to look into the chat and just throwing different ideas up. And just a reminder as well, if you have any questions, to try and remember to put them in the Q&A box, because that's where we're going to really be focusing, look for the questions. So of course, fiber is right up there. I see dietary fiber as a nutritional component of wheat-based foods that could be good for the health, absolutely. So we'll talk more about this, but any other ideas about nutritional components of wheat-based foods? So possibly the protein, B vitamins, micronutrients, magnesium, different micronutrients. Yeah, those B vitamins. Yeah, thinking about wheat-based foods, essentially, the refined ones are mandatory enrichment back in Canada, absolutely. Fiber is a big one. We love dietary fiber. Okay, so thanks for that. And we're going to continue on. So thinking about heart disease, we're just going to talk first and remind ourselves that heart disease is a major concern that we are preoccupied with, thinking about how nutrition may mitigate the risk. Heart disease is the second leading cause of death in Canada. It's the leading cause of death in Mexico. And we know that there's many risk factors for heart disease. A lot we can't control, but a lot we can do things about it. And diet is a huge one. So here we're talking about wheat today. And we know that wheat-based foods can be a source of many nutritional components that could benefit heart health. So we know whole grains, dietary fiber, resistant starch, B vitamins, all of these are studied in the literature as components of wheat-based foods that can benefit heart health. And so here I wanted to include this research study as our research spotlight for heart health. There are so many studies that have been done. You know that when meta-analyses are done, this is an indicator of consistency of evidence. And here, this particular study was a large meta-analysis combining all of these studies. So there was 45 cohort following people over time, 21 clinical intervening that examined, specifically focused in on whole grains. And a lot of these were wheat-based food studies and looking at diabetes as well as heart disease. So these studies are pretty large. The cohort studies up to 90,000 people followed for 26 years, and the clinical studies up to 200 people intervening for up to 3 months. And overall, these results combined together showed that 3 to 5 daily servings of whole grains significantly was related to reduced risk of diabetes and heart disease by up to 25%, and as well, less weight gain over a 13-year period. So this is a really core evidence-based study to show that whole grains can reduce the risk of heart disease and diabetes. And wheat-based foods definitely are a source of whole grains. And so this is a good research spotlight to include in this topic. And so we're going to shift now to diabetes. And with this, we're going to talk a little bit about glycemic index. So I want to see about some ideas about wheat-based foods that have a low glycemic index. And we'll throw that in the chat, some examples of wheat-based foods that have a low glycemic index. So I'm seeing some pita breads, possibly wheat berries, all bran. Interesting, yeah, good point about the pasta in terms of how it's cooked. Oatmeal, with more oats than wheat, but yeah. Yeah, so I'm sure we can come up with lots of different examples. Glycemic index is really an interesting topic, and a lot of us on the call, all of you, are well familiar with it. Complex carbohydrates, absolutely. And speaking of the word complex, all of this is definitely complex, but very interesting. So let's first just take a moment to realize that diabetes is a concern that we are wanting to focus on. 30% of Canadians are living with pre or diabetes, and 30% of Mexicans are living with diabetes. And we know nutrition is pretty core to managing and preventing diabetes. It's definitely part of the practice guidelines, and it's really important. Now, we also know that nutritional qualities of wheat-based foods can contribute towards diabetes prevention and management. Whole grains, dietary fibers, and indeed wheat-based foods that are higher in whole grains and dietary fiber do have a low glycemic index. Now, in terms of a research spotlight, we opted to include this study just because it's really interesting, and it focused on glycemic index values of pasta products. So pasta is a wheat-based food, and interestingly, it's considered a low glycemic index food. Now, as Sue mentioned in the comments, a lot of the complexity can come in how you cook the pasta, but we're just going to focus on the pasta itself right now, and recognizing that the compact structure of pasta actually protects the gluten from being broken down, and that intact gluten network interacts with the starch in terms of reducing its breakdown as well and slowing glucose absorption. So there's evidence around glucose and amylase interacting. So this is suffice to say that this study, as well as others in the literature, established that pasta has a low glycemic index, despite it being a refined wheat food. And it's just another example of a functional contribution of gluten. And it's interesting and relevant to consider in a dietary pattern to reduce diabetes risk. So I thought it was kind of an interesting study to include. Now, the last topic that we're going to cover an overview is that of gut health. And with respect to gut health, we have prebiotics, probiotics, so many ideas. But here we just want to do a poll about, do your clients think that wheat is a prebiotic? Yes or no, or not sure. Maybe your clients don't even know what a prebiotic is. So how would you answer this question? Okay, so thanks for that. So it's very across the board. Yes, no, and unsure, all across the board. So let's talk a little bit about wheat and gut health. Now, we know that the bacteria in our human intestine is referred to as the human gut microbiota. And we're learning so much about the human gut microbiota or human gut microbiome. We've known for a long time that it's important for digestion and absorption of nutrients, but more and more evidence is supporting its role in disease risk. And so this is a very, very active and advancing area of research, that is the gut microbiome and disease risk. Now, in terms of wheat-based foods that are high in fiber can definitely contribute to the gut microbiota. And this is because the fiber is fermented by our intestinal bacteria. That fermentation process is going to alter the composition of the gut microbiota. It's going to alter the types of bacteria in a way that are then implicated in disease prevention. And it's also going to have those bacteria that then produce short chain fatty acids, which are nutrients themselves. They actually contribute to the fate of other nutrients, but they are also absorbed. And short chain fatty acids, often SCFA, they have been shown to impact physiological function in a way that's beneficial for different diseases. So there's a lot going on here. All of it relating to wheat would be the idea and ability for the fiber in wheat to be fermented by the intestinal bacteria. And this idea of providing what you could call a substrate for the bacteria is what is a prebiotic. It's something that's providing something for the bacteria to flourish, as opposed to a probiotic, which is the actual bacteria. And so this study is a real fitting research spotlight. There's been many studies like this, but I thought this was kind of the most relatable, thinking about breakfast cereal. So whole grain wheat breakfast cereal has a prebiotic effect on the human gut microbiota. Just that sentence alone tells us the evidence. In a very high quality study, they had 31 adults consume some whole grain wheat cereal or some wheat bran rich cereal for 3 weeks every day. And every participant consumed both cereals. They separated it by 2 weeks. And they collected their fecal samples before and after so that they could look at the bacteria in those fecal samples and get an idea of what was going on. And the results showed that in those fecal samples, the bacteria specifically considered more healthy, lactobacilli, bifidobacteria, were higher with both of the cereals, but significantly more so with the whole grain wheat cereal, but still higher with both cereals. And so this study, as well as other ones that have been done similar to this, provide clear evidence of a prebiotic effect of wheat. And so overall, this presentation has enabled us to explore these kind of 5 overall topics. First of all, wheat basics and nutrition. What are kind of some core ideas? A real focus in on refined wheat and nutrient fortification. And then looking at wheat in heart health, diabetes, and gut health through thinking about a relevant question, looking at some basic information, and looking at a study. Now, we can't go over everything in one webinar, and there's lots to think about and lots to go over. One of the things that we want to make sure that we do is stay evidence-based. And that's really what the What About Wheat initiative is about. It's really trying to translate the evidence that's out there. And in kind of participating on this What About Wheat Nutrition Initiative work, I can say this is very rigorous. The information is all evidence-based. It's something that I'm really interested in helping to advance. And you can see here that the What About Wheat overall on the website at the top there's many different sections like Wheat 101, nutrition research, thinking about Canada and wheat production. Today, we focused on the nutrition research. So you can see on your bottom left, the Wheat 101, whole grains and fiber, enrichment, fortification, the gut health, the heart health, the gluten, and the diabetes. And within each of those, you can go to the website for more information. So for example, the gut health on the right, that's showing you some quick facts and then just some background information and all of the studies as well. You can get links to them there. So this is a really great, really resourceful option to just kind of learn more and peruse. In addition, we're going to create a handout from today's webinar that you will have access to provide you with summary information and as well answer questions. And so at this point in the presentation, I'm going to hand it over to our colleague, our Latin American colleague, Daniel Guerrero, and he is going to give us some information from a Latin American perspective, after which we will have some questions and discussions. And so, Daniel, I'm going to stop my share to allow you to start your share.
Thank you, Alison. Let me show it. It should be working now, right? Thank you. So hi, good morning, everyone. So as members of the Latin America Cereal Institute, I appreciate this space to be here with you and to share some highlights of the role of cereals in the Latin America region and the specific cereals that are making our grain intake throughout LATAM. So we know that cereals are the main source of energy across the region. They are affordable and widely consumed, which makes them a great vehicle for fortification. So if we see in this slide, I included the flour fortification requirements throughout the region. And all the countries require fortification. All of them require fortification of wheat flour. However, from there starts the differences. Some require both refined and whole grain to be fortified, while others, it's only about the refined flour. And also some others include corn flour fortification. Generally, they require B vitamins, folic acid, and iron, which are the main nutrients of concern in Latin America. But in general terms, across all the region, it is recognized the relevance of cereals as staple foods. Next, in this slide, I have information that comes from a study named the Latin America Health and Nutrition Study, which includes country representative information of the adult diet for 8 countries across Latin America. And what you can see from this study is that from the southern part of Latin America, wheat plays a very important role, either through bread or pasta as the main sources of cereals. However, as we start to go up to the north, we will start seeing much more predominance of rice and corn. However, what is common across the region is that most of the grains that are consumed are refined. And we have heard from Alison on the relevance and the benefits of consuming sufficient whole grains. And if we see the numbers from the study, we can see, for example, Costa Rica, that has the highest whole grain intake of the region with about 20 grams per day. However, if we compare to the recommendations, let's start by the ideal ratio on looking that at least half of the grains consumed are whole grain. So in this case, it's about just 5% and not 50. And the absolute recommendation for whole grain in wet basis is 100 grams. So the gap that we have in whole grain intake in the region, it's about 80%. And that can be directly translated on the shortfall nutrient that we have behind fiber on the region. So finally, just some thoughts to keep in mind. So cereals and grains are the main energy sources for LATAM consumers and widely recognized as great vehicles for fortification across LATAM. The main vitamins and minerals include vitamin B1, B2, B3, folic acid, iron, and zinc. Despite the significant intake of grains and cereals, there is still a great opportunity to increase whole grain intake, where the available information shows that the intake is substantially low. So examples of efforts around the globe to promote whole grain intake include clear definitions and regulations, quantitative recommendation on dietary guidelines, and public-private partnership initiatives. For example, Denmark, they have been really successful on increasing whole grain intake of the population, and also incorporating whole grains into front-of-pack labeling schemes to facilitate recognition. And last but not least, if you want to know more on the initiatives to increase the consumption of whole grains, you can visit the Whole Grain Initiative webpage, where you can find multiple efforts that are undergoing in that front. So thanks, and handing back to you, Alison.
Excellent. Thank you so much, Daniel. I am going to share my screen again. And at this point in the presentation, we're now able to take some questions and discussion with Meg and Daniel and myself. So what we're going to do is kind of take turns doing that, and just encouraging you to put your questions into the Q&A box, and we're going to address them, take turns. And I think Meg is going to start to address one of them, and I will look at another one while she's doing it, and then I'll take a turn after that.
Yes. Yeah, thank you so much, Alison. Hi, everyone. So nice for everyone to be able to join us. And we had so many attendees today, and some great questions coming in either through the chat or the Q&A. And so we're going to try and focus on those ones that came in through the Q&A. And then if there was any in the chat, we'll address those too. So one of the first questions we got was about if there's any whole grain wheat flours on the market in Canada. So there is. We're not necessarily product experts on all flours that are produced in Canada, but if you're looking for whole grain wheat flours, then we're focusing really, it should say whole grain, whole wheat flour right on the bag. But I think it's also important to consider the difference here between whole grain versus that whole wheat. So there might be some minor fiber differences, but there's pros and cons to each type of flour and how we're using it. So even just looking at the different flours and comparing the nutrition facts, you know, they are an important part of our diet, eating these wheat-based foods, but it's not the end all be all. And this is, I'm sure, as lots of dietitians would recommend, a varied diet is really important. So as long as we're mixing these whole grains with other type of wheat-based foods, I think that would be most important. But you can look for those flours. It is really specific and hard to find, but it will say exactly whole grain on it. Anything else to add to that, Alison?
No, that was, thank you. And a really good question. Okay, so another question in the Q&A box relates to the research spotlight that we examined, showing that the whole grain cereal had a prebiotic effect, and kind of strange that the wheat brand cereal didn't have a better, significantly better, because it was higher in fiber. Yeah, so I didn't really get into that, but I actually also had that perplexing question when I read the study. So first of all, just to remind everyone, so this study demonstrated that wheat-based foods, cereals, had a prebiotic effect. It had a whole grain group and a wheat grain group, and both of them showed significant differences in the bacteria that are considered more beneficial. But the wheat, or the whole grain, was more. And yeah, if you look into the details of the study, it had less fiber than the wheat bran, as we would expect. Now, it gets a bit complex when you look at all the details in their discussion around that. They also looked at other outcome measures like short chain fatty acids and other bacteria, and they don't address it a lot in the discussion, but there is a component where they speculate that the effects on some of the other bacteria may have disabled the effect to have a significant higher. They also mentioned that there could be other non-sugar carbohydrates in the whole grain cereal that would have contributed to the higher lactobacilli and bifidobacteria. And so it is all complex, but the bottom line is that both of them were able to confer a benefit in the bacteria. So very good question.
Yes. Yeah, I think that's great, Alison. And we have on our gut health topic page on the website, a little bit of a discussion about the fermentability of fiber and how that's actually more important than solubility. So I know as dietitians, we might, not that I'm a dietitian, but in this nutrition health space, we might look more at soluble versus insoluble fiber. But we have a gut health expert who is part of our working group and scientific advisory committee. And he mentioned and has supported us in writing about how fermentability of fiber is really important for gut health. So I think that's a great opportunity to dive deeper into that. Just looking for some other questions. There's lots coming in now.
Maybe I can take the next one, translating from Spanish to English. So it says, which are the main nutritional components that are lost during the manufacturing process of, it's not whole grain, but let's say whole bread and flaked wheat. So if I can take that from the industry perspective, so generally, if we would talk about whole grain, it means that we are keeping the three components of the grain in the same ratio that we would find the grain on the nature. However, during processing, you will have some losses of those vitamins that are more sensitive to high temperatures, mainly B vitamins. So that's the reason why we are reconstituting those B vitamins into the product to ensure consumers are getting the right level of fiber and nutrients. And I don't know, Alison or Megan, if you would have anything else to add.
No, I don't really have anything else to add. Exactly. I think the nutrients that we're adding back in are exactly those, most of those that are lost. And this relates to another question that was asked earlier about, you know, you can have those refined grain products where they have lost some nutrients, they've been added back in. Part of the fiber is still missing. So some flours or refined wheat products will also add back in the fiber. So they are really, trying to make it all back to be whole and get all those benefits. So there's a lot of different varieties of these products, but yeah, you're exactly right.
One question I noticed that I think would be a good discussion is, how is it that the impact on gut health would relate to heart health or even diabetes for that matter? And I think that kind of the key and ticket to that is those short chain fatty acids. So when the prebiotic, when it's fermented, short chain fatty acids are produced. And these short chain fatty acids, they can be absorbed and they've been shown to impact metabolism in a way that can be relevant for heart health. So probably the best example is thinking about like LDL cholesterol and total cholesterol. Those can both be affected favorably by short chain fatty acids. So that is, I think, the key mechanism of the connection between the gut health and the heart health.
Yeah, I have nothing else to add. That is great. It's actually really amazing what our gut does for disease risk reduction and all the connections we're finding. So I think there's an interesting question here. I'm not quite sure we're able to answer it today, but they were talking about wanting wheat to replace rice and corn in the diet. And are there studies to show the health benefits of the stronger protein profile of wheat versus rice? I would have to look at the literature on that. I believe it could exist, or I'm thinking along the lines of some of the work where they look at removal of certain foods in the diet. So it's not necessarily a study on how they replace a food, but more what's the consequence of when they remove a food. And that's kind of what we highlighted when we talked about the refined grains, and that those do have a role in our diet to help with nutrient adequacy and making sure our diet is complete. So I feel like we might be able to find something, and this would be a great opportunity to follow up, add to our FAQ or add to our website, and have this information that you are really looking for. So thank you for that. I don't know, Alison or Daniel, if you would have anything to be able to add to that question about replacing corn or rice in the diet with wheat and any benefits on that.
Maybe just the only point is that wheat has a higher level of fiber than what you would have on corn, and rice is really low in fiber if it's not whole grains. So at the end, I think the main difference would be on a higher fiber level that would come from wheat.
Mm. Yeah. I've seen an interesting question about long fermentation. And I think it's a really interesting topic because that concept of sourdough, especially because of the popularity of sourdough bread, there is a literature base around physiological effects of sourdough and acetic acid, and there is evidence to support a role for it in favorably affecting diabetes management, postprandial glycemic response. And it is very interesting and a consistent level of evidence. It is an area that I thought about including as a research spotlight for our webinar today. So I really welcome that question. And it's like relevant because you think about refined wheat products that are also sourdough, that has an element of potentially mitigating diabetes risk to a comparable extent as a whole grain wheat base that's high in fiber. So that evidence is there, and I think it's really interesting.
Yes, yeah, I see Michelle asked that question and mentioned that she is a natural yeast baker. Power to you. I haven't been able to master that yet. Also, Daniel, I noticed there was another question in Spanish, and I think you were replying or looking to reply to that one.
Yeah, it's already handled.
Okay. Was it worth translating for the English participants, or?
So the question was whether, so which is the driver of why there are different nutrients that are required to be fortified within the flours across the countries, whether that responds to the regulations or to the country requirements. And at the end, it is answered by both. So at the end, it is because of differences on the regulations coming out from the different authorities. However, those requirements are based on the shortfall nutrients from the population.
Yes, yeah, great answer. And I think that also highlights the differences between countries on these definitions. And I know being in Canada, we may be buying Canadian products, but we might one day soon or already have traveled to the States, or we see advertisements or things on social media that might be from the United States or other countries. And so this is where it's really important as health professionals and those communicating to the public to make sure we're able to answer those questions and make that distinction. In the United States, for example, they don't have the whole grain versus whole wheat difference. That's all the same product. And I know we've had these conversations, Daniel, Alison, and I, on even in Latin America and Mexico, what those definitions are and how they don't translate quite so clearly between the countries. So it also makes the research sometimes hard to discuss and make applicable to all the populations, because you really have to look at what foods were they studying, and if they said they're studying whole grains or whole wheat, what did that mean? So it's definitely more confusing than we might have thought initially. So that's great. Yeah, these are really good questions.
I see two questions coming here. So one says, talking about gluten, how can we talk about it as a protein we need on our diet besides the criticism on celiac disease? And I think here the point is, so we know that gluten is bad for people that is celiac or that has specific sensitivities. However, gluten is not bad for someone that has any of both conditions. So at the end, I think generally it came this generalized, let's say, trend of people avoiding gluten. However, research has shown that if you don't have any of both conditions, you are actually okay to continue eating wheat and gluten without any issues. And just the other question is, what is the proper amount or balance between whole grain flour and refined flour in our diets? So generally, the recommendation is that we should strive to have at least half of the grains that we are eating as whole grains. And from a quantitative perspective, it is 48 grams per day in dry basis, which is 100 grams on a wet basis.
That's great. Thank you, Daniel. I'm just looking, there also is another question, and I think it might be an interesting conversation, and perhaps one of the last questions we'll be able to answer. We also got some questions during submission. So again, we're going to look at ways to make sure everyone's questions are answered. And so this is a question that says, there is this idea that pasta being a refined product can be harmful to consumers with diabetes, but why do doctors remove it from their diabetic patients' diet, seeing this from the point of view of the research mentioned? And I think that is a lack or a gap in people's understanding of how refined products can fit in our diet. And like Daniel was just talking about gluten, how gluten participates in that whole food pasta complex to make it digested slower and actually make it a low glycemic index food. So I think there's a great opportunity to have more education and be able to share this information. Patients definitely can come to their doctors and say, you know, I have this information and I'm questioning whether I should move from their diet, and we need to be able to empower people to do this. So I think, yeah, I think this is a great opportunity to be able to share this information we're providing, and then empower people to have these conversations with their healthcare professionals, and we can help bridge that gap in miscommunication. I know we're just about to finish up. Alison, I don't know if you wanted to add something on that before we pass it off to Elaine to finish the webinar.
No, I think we'll let Elaine now make some closing remarks. Thanks, Meg and Daniel.
Thanks.
So yes, it is time for us to wrap up today's webinar session. And I'd like to thank everyone for taking time out of their schedules to join us today. Thank you also for all of your wonderful questions and feedback. It's always great when speakers have this type of engagement with the audience. So again, we appreciate that. We recognize that we weren't able to answer all of the questions that came in today, but we would like to follow up with the answers to those questions, as well as the handout that was mentioned from today's session. And this will be sent to the email address that you use for your registration. I'd also like to thank our 3 experts today for sharing their knowledge with us. I know that I learned something new today, and I'm hoping that those that attended did as well. Thank you to our interpreters, Carlos and Monica, as well as our audio-visual coordinators whose efforts helped ensure that everything ran smoothly today. Please consider staying in touch with our What About Wheat website, as well as our social media accounts on Instagram, Twitter, and Facebook. And finally, please make sure to complete the survey, as it will help us focus the content for the next webinar and make any improvements that are required. So with that, our webinar has now ended, and please enjoy the rest of your day. Thank you.